Okay, guys, welcome back. It's me, Kira Stevens. This is MP Now's YouTube channel. I'm coming on a little bit late today because I've been doing a lot of work. As I told you guys last week, I'm starting a new business. So I'm trying to get all those things finalized and so I can go live next week, June, or probably June 1st, the latest. The reason why I picked the topic of NPs and collaborating physicians today is because I actually signed the collaborative agreement with my collaborating physician that I'm going to be doing my business with. And I wanted to give you guys a few tips and just some information regarding collaborating physicians, what that actually means, why do you need them, and what their role is. So, a collaborating physician is someone who you basically, depending on your state, it basically says that that person is, looking at your charts, or that person is someone who's responsible for your work, or that person is someone you can call if you have a question. Like I said, it really depends on your state, as far as what that collaborating physician has to do. Some people have independent practice and don't need a collaborating physician, so this doesn't even apply to you at all. So it really depends on the state. So for me, I'm in a yellow state per se. You would say New Jersey is yellow. It's not green. Full practice, we have some restrictions saying that, we have to have a collaborating physician involved in one aspect of our practice. And then there's really red states, like restricted states, like California and Florida. So they basically are is someone who the state feels like you need someone as a guide. They can do anything from review charts to go over every case with you. They can be really involved with you as far as going to every room when you go see the patients, when you were in clinicals or something like that. Or they can be pretty hands off and trust you and feel like you can do whatever you want, just call me if you need something type of thing. So it also depends on what the state requires of your collaborating physician. Sometimes they have certain requirements that they have for the state, and you just have to go on your board of nursing to figure out what that is to help you. Um, you also have to have some type of documentation, usually saying that you have a collaborative relationship with the physician. Sometimes you just have to have that on your person when you're practicing. Sometimes they'll require you to send it into the state, and sometimes they'll just require you to have it at your practice location. So if you were to say, have someone visit, you have it out and you're able to have that documentation showing that you have a collaborative physician. There's examples of collaborative agreements that I have found online. I also give a couple of examples with my course that I offer at mpnowllc.com, so that you guys have an idea, especially if you're if you are trying to develop your own practice. I have written up several collaborative agreements for myself, and I basically have gone off of previous collaborative agreements and whatever the state requires. And sometimes the state is very big, so don't be upset if you call your state and you ask and you don't even get an answer, your board of nursing, and you ask them, hey, what do I have to write in this? Or hey, what is my collaborative physician required to do? Because the stuff online is so vague, and it's just a little bit annoying that it's so vague like that, because number one, they try not to take on any liability. And two, I mean, it's almost stupid that they even ask of this. That's how crazy it is to begin with. Because, like I said, some states don't even require you to have a collaborative physician. It's just something, one more restriction that's put on nurse practitioners. And it's really sad that it's like this. But, if you really want to stay in the profession, you have to follow the rules, and you don't want to have to be sitting in front of a board saying why you did something and trying to plead your case, and your license is on the line, because this is our livelihood. So just practice safely and practice ethically and practice legally. That's all that that's the number one thing that you need to do. um So usually your collaborative physician is provided to you by your job. I know my for any job that I've worked at, it's usually my boss or my chief or the physician that I'm working with or someone who is like the chief medical officer of the company. Their name is usually the person who's being referred to as being my collaborative physician. I never paid a collaborative physician when I worked for a company. They were always paid or compensated according to whatever that was by that company. For instance, I know one organization I work for, this was a big hospital group. I think and this is just from word of mouth. I don't know how true this is, but I was told that one collaborative physician was paid like $1,000 a month to take on like 5 NPs or something like that. I don't know. And you also have to be careful and make sure you are aware of all the laws, because I know in some states one doctor can only supervise X amount of nurse practitioners, and in some states there is no limit. So that's why I say when you like look at the state guidelines and if you call the Board of Nursing, sometimes things are very vague. Like for instance, myself, I looked at New Jersey to see if they have a limit on the number of nurse practitioners that they can be supervising. And if there's a way to look up and see if that doctor is already supervising someone, because I want to always practice safely, especially when I'm branching out on my own to start my own practice. And that information was not available. And on the website, it said nothing about how many page NPs that the physician can supervise or anything. And then I've seen in other states, I believe it's California, one physician can only supervise about 5 nurse practitioners in that state. So that's just as an example. So I met with my collaborating physician yesterday. If you are, I found her on Indeed. So if you are looking to start your own practice, you live in a restricted state, you're looking to collaborate with a physician so that you can do your practice or whatever the case may be, do not pay a company $1,000 a month just to find a physician for you. It's really a ripoff, and you could do it yourself. I put an ad on Indeed back in February. I got 18 applicants. I also put an ad on Craigslist, got 2 applicants. And I think I narrowed down my possibilities to 4, and I went with 1. And the reason why, I looked at it as who was going to be the best fit for me as far as my practice and what I wanted to do in my practice. So, of course, number one, I made sure that they were within my budget. So I asked for a certain amount of money. I'm paying a little bit more than I was offering. Excuse me, I offered a certain amount of money. I paid a little bit more than what I was offering, but it was nowhere near like $1,000 a month. And then with that, I believe that I just wrote up an agreement, checked the physician out, make sure that they had an active license in the state that I needed, and that they didn't have any type of things going on. Personally, I don't need them for anything except for the piece of paper. I'm paying them for a piece of paper, but that's okay because as I was talking to you guys in the last episode, I'm going to make the money back because money is an important part of our practice. I don't care what anyone says. It's not to be used as the end all be all, but it is a tool to get you what you need to help people. It's just mainly the tool to help people. So I truly don't mind paying what I need to pay, and it's not anything crazy. And so just make sure that, whoever you decide to be your physician collaborator, make sure you check them out. Look on the medical board courses of action. And even if they do have a history, as long as they have an active license, you don't need it depends on what you're doing. You don't need them to do anything. Like they just, sometimes I've heard people look on the actions board for the medical appeals board to find out what physicians were basically out of a job. Like they had an active license, but they fell into trouble with Medicaid and Medicare or the DEA or something. So they can't prescribe certain medications. You could technically potentially capitalize off of that and use that person as your collaborative physician, as long as you don't need to use their licenses in your practice, and you yourself is in good standing. Because at the end of the day, it's just okay. It's fine that you just have to make sure that you're good. So basically make sure you're up to date on your license, your certifications, and you're practicing safely, ethically, and within your scope of practice. And that is basically all you need to make sure that you do. Now, my reason for looking them up on the board was to just make sure that their license wasn't suspended. Their license is suspended, and they basically have no license. They have you have no use for them. So you just got to make sure that you be careful and you find out what it is you actually need from them, whether you need them to just sign a piece of paper, or you need them to review charts, you need them to physically go in the rooms and see your patients, or whatever the case may be. They got to be willing, and able to do those things so that you can remain compliant with the Board of Nursing and within your scope of practice. So also, big one, your collaborating physician, when you're hiring them, big thing. So if I am paying someone to be my collaborating physician, essentially they work for me, not the other way around. You are the CEO of this company. When it comes down to business transactions, when it comes down to the way that you run your business and things like that. When it comes to patient care, and I've seen this in a lot of contracts, whatever the doctor says supersedes whatever the nurse practitioner says. For instance, say you have a patient, you have your own practice, you have your own clinic, you run by yourself, but you have a collaborating physician. You call the collaborating physician. You guys disagree on, hey, should I, do X, Y, Z? I want to send this patient home, and then the physician is like, no, send them to the ER, because that's clinical practice, and that doctor technically has a higher degree than you. When it comes down to the medical aspects of your patients, you have to do whatever the physician says, especially in the restricted states and whatnot. So if you're in a full practice state, you really don't have to worry about that. But when you're in a restricted state, yellow state, red state, whatever the doctor says medically supersedes whatever your decision is. And when it comes to the business aspect of your practice, as far as payments and how things are set up, and services, things like that, you are the CEO of that company. What you say goes, basically. So just make sure you keep that in mind, because I'm a really big advocate of everybody branching out and doing their own business and doing their own thing, especially because I've been finding a lot of freedom in that for myself. And I can see that being my full-time life in the near future. So thank you for watching my video this week. I'll see you guys next Sunday. And make sure that you follow me on my Instagram page at NP Now LLC. And then I'm also on Facebook at NP Now LLC. And check out my website if you have a question, if you guys have any comments, if you have any topics you want me to go over, send me a message on my website at npnowllc.com. And then you could check out my consulting and mentoring offerings, as well as my new graduate nurse practitioner course offering that I have. So if you're like a new graduate nurse practitioner, you're within about your first year of practice, then you can take my course that I've developed for you. It has a lot of information and a lot of things that I wish I had known when I was a new grad NP. So thank you guys for coming on, and I appreciate all the subscribers, all the comments, all the interactions. I appreciate it all, and I will see you guys next Sunday. So you guys be well and have a good one.